Welcome to sciencewiz technology. Here we are going to review today. We're going to review the spinal cord. First of all, we're going to take some notes before we go into the 3D model. So we're going to talk about the definition of the spinal cord. So spinal cord. The spinal cord is a long tube-like band of tissue which connects your brain to the lower back. Your spinal cord carries nerve signals from the brain to the body and vice versa. These nerve signals help you feel sensations and move your body, and any damage to the spinal cord can affect your movement or function. So here we have the spinal cord and its functions. Please note in your notebook, what are the functions of the spinal cord and the parts of the spinal cord. First, we're going to talk about the cervical. So the cervical has 7 vertebrae, 12 thoracic, which is the next part. Then we have 5 lumbar. Then we have 5 sacral. And then we have 3 to 4 coccygeal vertebrae, which are also infused. So let's go to our 3D model, which is powered by BioDigital. So here we get a better picture of what is the spinal cord, okay? And the different parts of the spinal cord and how they are labeled, okay? So we have the red, and you're guessing what is that? The red is the cervical. The green is the thoracic. The yellow is the lumbar. And the pink is the sacral. And the blue is the coccygeal. So this is a great way to memorize the spinal cord by using color coding the spinal cord. I also recommend, if you guys have a book that includes a picture of the spinal cord, I would recommend you labeling it by color, because that is a better way to memorize the spinal cord. All right, so we are going to continue, and we're going to talk about the intervertebral discs. All right, so the intervertebral discs, let's look. As you may see here, we have the tough outer fibrous ring called the annulus fibrosus. Okay, and here, when there is an accident or a traumatic injury, or trauma, there is degenerative changes or mechanical traumas causing tears in the outer annulus fibrosus, squeezing the nucleus pulposus, which can exert direct pressure on the spinal cord on itself, or even more, on the nerve roots. As they leave the spinal cord, this is known as, when you go to the doctor and they characterize this as a disc herniation, okay? So here we have a perfect picture to illustrate this. We can look at this intervertebral disc. And, okay, so here I also want to make note about the purpose of the spinal cord before we go on, actually, because you must know that the spinal cord has, and its main purpose, to carry the nerve signals throughout your body. These nerve messages have 3 crucial functions. They control the body movement and function. So they signal your brain to other parts of the body, controlling your movements. They also direct autonomic, involuntary functions like your breathing rate and heartbeat, as well as the bowel movements and the bladder function. Then we have, it also can report senses to your brain. So the signals from the other part of the body to help your brain record and process sensations like pressure and pain. And then we have the manage your reflexes. So this is, usually it includes the reflexes, which are involuntary movement without involving your brain. So for example, your spinal cord manages your reflexes, which is moving your leg when someone taps your chin or in certain spots. So, so what includes these tissues? So what tissues and fluids make up the spinal cord is my next question. So, so we have meninges, which cover the spinal cord. And these are protective tissues, which include, and please make note of this in your notebook, we have the dura mater. All right, we have the dura mater. Let's go into our notes here and let's make note of that. Because, let's see if I can delete this. Okay, so, all right, let's make note of that. Let's make note of the dura mater. And that's how you spell it. So please make note of that in your notebook because you might be asked this on your exams. So what is the dura mater? So the dura mater is the outer layer that protects your spinal cord from an injury, okay? So if you guys want to write that down in your notebooks, so let me write it in a simpler way. So it protects your spinal cord from injury. Okay, so then we have the arachnoids matter. So let me spell it out for you guys so you make note, because it might be a little difficult word. Okay, so what is this, you may ask? So this is the middle layer between the epidural and subecrinoid space. So let's write that down. So that is the middle layer between the epidural and subecrinoid space. Let me write this a little better. Sorry for my writing. All right, so then we have the pie matter. Okay, so what is the pie matter? So the pie matter is the inner layer that covers your spinal cord. So inner layer that covers the spinal cord. Okay. All right. So we have 1, 2, 3. And you're probably asking yourself, why did I put it in this order? Well, I wanted you guys to understand that the acrinoid matter is the middle layer. Okay. Then we have the dura mater, which these are the layers of the spinal cord. Okay. So then we have the dura mater. This protects, please may note, protects the spinal cord from injury. Okay. Then we have the acrinoid, which is the middle layer, okay, of the epidural and the subacrial space. And then we have last the pie mater, which is the inner layer that covers the spinal cord. Okay. So what are the epidural and the acrinoid spaces? So we're talking about what is the epidural and what is the acrinoid spaces, right? So epidural space is between the dura mater and the acrinoid mater. This space is where the healthcare provider, the anesthesiologist, inserts an anesthesia during childbirth known as epidural, okay? The subacrinoid space is between the acrinoid matter and the pie matter. Here, the CSF, which is called the cerebral spinal fluid, which provides extra cushioning and protection for the spinal cord, okay? Cerebral spinal fluid, okay? All right, so then we have, so sometimes the provider needs to insert a needle into the subacrinoid space to test the CSF for the certain infections, okay? So this procedure is also called the spinal tap. So both the epidural and the acrinoid spaces provide extra shock absorption for your spine. Okay, so all right, so now we're going to talk about the nerves. Also, please, if you guys have any questions of what I'm talking about or you want to know more, please message me and I will explain a better way. If you guys don't understand this way, I'll try to find a better way to make you guys understand a better way. All right, so then we're going to go on to the nerves. All right, the nerves are a little complicated. I know some students had some difficulties remembering the nerves because there's so many nerves in the spinal cord, but there are 31 pairs, okay? So of the nerves and nerve roots in your spinal cord, okay? So these are pretty easy. You guys will learn. If you review this over and over again, it will stick to your head. So we have 8 cervical nerves, all right? And they start in the neck and run mostly into the face and the head. Okay, let's go back to our 3D model because I want to make note of that. Here, see if we got it. Oh, right here, perfect. So, okay, so here we have 8 cervical nerve pairs, okay? This is a perfect picture because here we can see all the vertebrates. So we have C1 all the way to C7, okay? So, all right, so we have the 8 cervical nerves. Also make note that there are C1 to C7, there's only 7 vertebrates in the neck portion, okay? And there's 8 cervical nerves. Then we go on to, let me go down a little more, see if we have a better picture to go into the thoracic part of get into more detail. Let's go back. Here, perfect. Okay, here we got the thoracic part, right? So there are 12 thoracic nerve parts, okay? In the upper body and extend to the chest and upper back and abdomen, okay? So 12, okay, so now we're gonna go back here and we're gonna note that down, okay? So let's do this color. Okay, so in the cervical region, we have 7 okay, and then we have 8 nerves, okay, and then we got, so we talked about the thoracic part. Okay, thoracic region, which has 12, right? And we have 12 nerves, okay? So then we go into the lumbar. And the lumbar has 5 nerves, nerve pairs. 5 nerve pairs, okay? And it also has 5 lumbar vertebrae. We also have 5 sacral. Sacral, we have 5 vertebrae. And we have 5 nerve ends, nerve pairs. Okay. So going back to the lumbar, because I want to make note. So the lumbar, the nerves in the low back run into the legs and the feet. Okay. And then now we're talking about the sacral, which has the nerves in the low back extend to the pelvis. Okay. And then the cervical, please make note while I'm talking. So the nerves start in the neck and run mostly to the face and the head. Okay. And then we go to the thoracic, which the nerves in the upper body extend to the chest and upper back and abdomen. All right, let's erase all this and let's keep going. All right, let's go back to our 3D model. So I want to talk about where is the spinal cord located? Okay, that's our next question. Where is it located? So the spinal cord begins, as mentioned, begins in the bottom part of your brainstem, which is called the medulla oblongata. Let's see if I have a better picture of this. Let's go back here. Let's see if I can put this bigger. Here we go. All right, so let's see if I got a little better picture. Okay, later we're gonna go on to the spinal curvatures, but I wanted a little better picture. All right, it's fine. Okay, we're gonna talk about the medulla oblongata. And the medulla oblongata is the bottom part of the brainstem, okay? At the lower back, your spinal cord forms a cone shaped called the conus mandibuloris, okay? Mandibuloris. All right, and so how long is the spinal cord? The spinal cord is 18 inches and 45 centimeters long. Okay, so I want to go over more about the medulla oblongata after we go into more about the spinal cord and the functions of the medulla oblongata because it's very important. It's the connection between the brainstem and the spinal cord. This carries multiple function centers. It is comprised of the cardiovascular respiratory regulation system, descending motor tracts, and ascending sensory tracts. Also, very important note, that is the origin of the cranial nerves, okay? And it conducts for the nerve signals to and from the body. Okay, please make note of what is the medulla oblongata and why is it very important. Okay, so now let's go on to, I wanted to mention some important facts about, some facts about the spinal cord actually, some very important facts. And various curious facts as well. So there's 26 vertebrae in adults. You may ask why? It's because the bones fuse as we age. So they fuse as we, get older. So also, we have 7 vertebrates in the neck of the human, but also we share that with giraffes. Giraffes also have 7 vertebrates. All right, and then I also want to say 3 important functions. So the movement of the trunk supports body and respiratory function and protects the spinal cord and nerve structures. Okay, if you guys want to make note of that. The average weight of the spinal cord is 35 grams. Very, very, very cool. Okay. And then we have, so also you're gonna, in school, they're gonna ask you the primary motions of the spine. It's gonna be flexion, extension, bending, and rotation. So flexion is forward. Flexion. We got extension, which is backwards, bending, which is left and right, and we have rotation, which is the central axis. Okay, we also have 100 plus joints. We have 120 plus muscles, and we have 220 ligaments in the spine. Also, very important fact is that we have 13 million neurons found in the spine. Okay. All right, that's very, very incredible. So now we're going to talk about, on actually a later video, I'm going to talk about the conditions and disorders affecting the spinal cord and why these injuries affect the spinal cord and some serious disorders that can cause severe symptoms in part of the body below the injury. And we're going to talk about some common conditions that affect the spinal cord and how can you keep your spinal cord healthy, okay? So all this will be in the next video. I just wanted to do a basic overview of the spinal cord. So thank you for Biodigital 3D Anatomy Zone for using its website, very important. Also, it's very helpful because you get a better picture of what does our spinal cord look like. So here is some notes to take if you guys want to pause the video and write all this down. It's very important, but also write down all the things I said because it's very important once you're doing your midterm, final exams, or even knowing it is very beneficial. So I want to thank everyone for watching this video and stay tuned for the next video because we're going to talk about, like I said, all this about the spinal cord and the disorders. Okay, well, don't forget to subscribe and hit the bell icon to watch the new videos. Have a great one, everyone.